Psychological care and mental health management to cope in the new normal. We need to understand and try to know that there is no one single correct way to respond to this. Presence of stress is not a sign of weakness. What we are experiencing together is a normal reaction to an abnormal event. We as human beings like to be certain and like certainty in everything we do. When things feel uncertain and when we don't generally feel safe, it's normal to feel stressed. But this can cause all sorts of havoc when it gets too much, when there's a sense of uncertainty and we are surrounded by conflicting information. Everyone reacts differently to stressful situations, so one should try to not feel guilty, shameful, or confused about how they are feeling right now or how they are reacting to this situation. To manage mental health and instill well being, certain practices can be adopted. Physical exercise, a stress reliever, even if one does it for 10 minutes a day. At home, simple stretching, exercise, yoga, motivating yourself and others, friends, family members can be beneficial. Breathing exercise is a simple task which works wonders. Practice to not look at cell phone or laptop first thing in the day. Avoid reading social media forwards and sharing unreliable information. Only refer to government advisories. Resist the temptation to know everything about updates on the pandemic every day and all the time. Decide a time and only that time you should check news, and if one is feeling too overwhelmed, politely convey to your family members or friends who are sharing these updates to not share them with you. It's important to bring your attention back to the present and focus on things in your life that are in your control. These can be your daily routine activities at your home, spending time with your children, spouse and family members, friends, and following the safety measures given by WHO and government authorities. Other important measures are like eating healthy food and keeping oneself hydrated, but also having comfort food from time to time as it improves mood. Try having a set routine for your sleep. As many of us are working and studying from home, inactivity can affect sleep schedule. But it's important to maintain a proper sleep pattern and getting a minimum of 6 hours of sleep every day. Spend time with family members, play indoor games, board games, talking to family members, friends, using this time to teach children new things, helping out in studies. Social distancing does not mean emotional distancing. Online community offers a plethora of support groups. One can try making friends and staying connected to others through social media. Try to not isolate yourself in room. Personal space is necessary, but make sure to sit with your loved ones from time to time and have meals together. Deliberately increase contact with those with whom you feel you have lost touch. Keep checking up on your loved ones that are quarantined alone. Those that are quarantined alone must try and stay in touch with their friends, family, and acquaintances through video calls and chats. Those staying with their families should try to share the burden of household work so that everyone stays busy and the burden of work does not fall upon one person. Get in touch with nature. Take walks if possible, sit with plants, watch sunrise and sunsets. Staying at home with everyone throughout the day may sometimes feel overwhelming, but try to give each family member their own space from time to time. For students, boredom can be managed through reading novels, books, taking up online courses, finish up pending work, playing games. It's important to work at our own pace without pressurizing ourselves with more work than we can handle during this time. Share family stories and old pictures of happier times. Talk to loved ones and share your feelings as it would give emotional benefits to not only the person receiving support but the helper as well. Talking with others and reflecting how they feel and empathizing may help invalidating one's own concerns as well. Avoid spreading rumors, gossips related to the pandemic. Practice your religious faith at home if that's therapeutic and helpful. To negate negative thoughts, first thing to remember is to know what's in your control and what's not. It's essential to remember that there are many medical, scientific, and public health experts that are working on overcoming this pandemic. Attempt to stay in present and not predict future, as right now we can't. When feeling too overwhelmed with anxious thoughts circulating in mind, bring your attention to the present in the here and now and notice what you can see, notice what you can hear, notice what you can taste, smell. Understand your feelings, emotions, and recognize how your past experience affect your way of thinking and feeling about this event, and how you can think and handle your feelings and thoughts and emotions in a better way. Remember that you are not alone and you are going to have both good days and bad days. Emotions keep transiting. Don't compare your life to what you see on social media of how much happier or productive other people are. Social media is not the correct reflection of real life, so one should learn to keep themselves away from it and maintain healthy boundaries. It is also helpful to maintain a journal and write every now and then about one's feelings and thoughts. Making it a habit is always helpful. It is very cathartic. It's also important to equip ourselves with appropriate information about conditions such as preventive measures, transmitting mechanisms, symptoms, illness duration, and possible treatment. Trust only the scientifically valid info, which is usually from government, WHO, etc. Be aware about the local condition and updates regarding government orders, rules, and regulations. Another way to manage these negative thoughts is to challenge catastrophic thoughts. Think to yourself, for example, am I thinking out of proportion? Is the government and medical fraternity really doing nothing to help us out? Is the mortality rate really as high as I think? Am I getting ahead of myself, assuming something bad will happen when I don't really know? Am I overestimating how bad the consequences will be? Am I overestimating the danger? Am I underestimating my ability to cope? These are a few ways one can manage their negative thoughts. Through this lecture, we learned about what are the correct ways to respond during this pandemic. What are the methods of practicing self care for the well being of self and others? And the different ways to manage negative thoughts during COVID 19.